My name is Roma with the Area Agency on Aging and the local SHIP office. Tonight, we're going to talk about Medicare Part D, the prescription drug benefit of Medicare. D stands for drug. Again, I'm with the Area Agency on Aging here in Colorado Springs. We cover 3 counties, El Paso, Park, and Teller. And the Area Agency on Aging works with our partner governments in those areas to develop programs and systems that allow people to stay in the community. I am the coordinator of the local SHIP office, the State Health Insurance Assistance Program. This is a federal program that is available nationwide. Every county and every state has access to a SHIP program. I cover 9 counties out of this Colorado Springs office. It provides free, unbiased information and education on all things Medicare and anything that could be associated with Medicare. Again, every county and every state has access to this program, at the very least by a toll-free statewide number in each state. I provided both my local Colorado Springs number as well as the Colorado statewide number. This is obviously in partnership with the Pikes Peak Library District, which we appreciate and have had for many years. And just as a heads up, CMS, the Centers for Medicare and Medicaid Services, is currently conducting a nationwide survey for people who receive any sort of SHIP assistance. So whether you attend a presentation, whether we talk to you individually, you may get a call at some point from the contractor that Medicare has hired to do this survey. And it's just asking, they're just going to ask you whether or not you found the assistance that you received from the SHIP program of any use to you, and whether or not you will move forward with whatever information they provided to you. This does directly correlate with this program's funding, so we do appreciate anybody who does participate in our surveys. Just a brief overview of what we've covered so far. In week 1, we covered Medicare A and B, original Medicare, eligibility, enrollment, and benefits and costs. Last week, we talked about the options for insurance that you can purchase or enroll in to go with original Medicare A and B, Medicaps, and Medicare Advantage plan. And again, tonight, we're going to talk about Medicare Part D. D stands for drug. It's the Medicare prescription drug benefit. So just like any other part of Medicare, the Medicare prescription benefit says you are required to enroll in this benefit or any benefit of Medicare. It is always optional. However, once you choose to participate in these benefits, you do have to follow specific rules and guidelines. So it is the newest benefit of Medicare. Didn't come into being until 2006. Prior to that, Medicare didn't cover prescriptions. Those costs were out of pocket for people. It is only for outpatient prescription drugs. So basically, you get a prescription from your doctor, you take it to your local pharmacy, they fill that prescription. That's what this benefit covers. The way this benefit is structured is Medicare, kind of like Advantage plans, Medicare is contracted with private insurance companies to provide this benefit to you as your Medicare benefit. And these companies do have some leeway as to what they are allowed and not allowed to do. So each benefit or each plan that you have to choose from in Colorado, and there are 20 different drug plans to choose from, standalone Part D drug plans. Each one of those plans will have their own list of drugs that they cover. They'll have their own premium, their own deductible, their own copays. If you go with a standalone, just separate Part D plan, you will have a monthly premium most of the time. Although I say that, and I know for a fact there's at least one plan with 0 premium. Or you could have your Part D benefits available through your Advantage plan, like we talked about last week. Advantage plans, for the most part, will include Part D benefits that work exactly the same as if you'd purchased it separately as a standalone plan. I may have mentioned over the last couple of weeks that there is financial assistance available for people who have limited or lower income and resources to help with the cost of this benefit. And we'll talk about that as well. So again, it is optional. You can choose or not to choose to enroll in this plan. But if you do choose to enroll, you do want to enroll during specific eligibility periods or enrollment periods. You're eligible to enroll in a Part D plan as soon as you are enrolled in either Part A or Part B or both. You do not have to be enrolled in both A and B at the same time to be eligible to enroll in a Part D. So for example, if you become eligible at 65, you choose to enroll in Part A only for whatever reason, you would want to enroll in a Part D to avoid any late enrollment penalties within that enrollment period, the same enrollment period as Part A. If you were to wait until you also enrolled in Part B, you could be subject to penalties, late enrollment penalties for not enrolling sooner. If, as with any other part of this, if you are actively employed and have health coverage through that employer is responsible for telling you whether or not the prescription benefit through that employer health coverage is considered creditable. What that means is that drug coverage would have to be as good or better than what Medicare Part D offers. And the employers are required to tell you that every year, whether you are eligible for Medicare or not. I know I get that letter from my employer every year. I'm not even close to Medicare eligible. So it is required by federal law that they provide that information to you every year. If you have drug coverage through your employer, or in this example for Part D purposes, if you have drug coverage through the VA pharmacy benefits are considered creditable as well. You do not have to enroll in a Part D at this time. You can delay enrollment until something changes and you might need a Part D. Did you have a question?
Is TRICARE in that too?
TRICARE does have drug coverage that is considered creditable, absolutely.
Okay.
So you would not need a Part D if you're a retired military and go with TRICARE for life. Even if you have employer coverage, your coverage may not be considered creditable as far as the pharmacy benefit. Again, the employer is responsible for telling you that. They're not required to provide you with creditable coverage, but they are required to tell you whether or not it is creditable. If it is not creditable, you might want to consider enrolling in a Part D, even if you have employer coverage. Even if you have employer coverage and it's considered creditable, you still may want to compare the cost that you have through the employer coverage with the cost you might have with a Part D. Sometimes you may save money by enrolling in a Part D versus using the employer coverage. It just really depends on the employer coverage, because employers are allowed to do whatever they want as far as what kind of benefits they structure for their employees. It's the Wild West out there. So it really is up to the employer, or for you to ask the employer whether or not that coverage is creditable for Part D purposes or drug purposes. So you would probably want to consider comparing the cost between the two options. How much you pay in premiums for the employer coverage. Some employers will pay the entire health insurance premium for you. Some employers do not. So it might be worth your time to compare the cost of, say, a Medigap versus your employer coverage, and compare the benefits to see what might be most cost-effective or better coverage. If you don't have creditable coverage and you don't enroll in a Part D because you don't take drugs, for example, you don't have any prescription medications to worry about. Again, that's your choice. You can do that. But if something happens down the road and some doctor down the road prescribes a prescription that you have to take, and at that point you decide you want to get Part D coverage to help cover that cost, you would have to wait until the annual enrollment period, and you would be subject to late enrollment penalties. You do have to worry about the enrollment periods, just like any other part of Medicare. The initial enrollment period, which surrounds your initial eligibility into Medicare, for most of us at age 65, that 7-month window is also the same window of time to enroll in Part D if you choose to do so. Then there's the annual election period. Again, we typically just refer to that as open enrollment, that October 15th through December 7th window every year, where you can get into, get out of, or switch from one Part D or Medicare Advantage plan to another. Any change you make during that window goes into effect January 1st of the next year. And then with all things Medicare, there are always exceptions to the rule. So there are special enrollment periods that someone might fall under. For example, you had employer coverage, it was creditable for prescriptions. You stopped working in July. and now you need to enroll in a Part D. You could do so outside of these other two enrollment windows. So again, late enrollment, you could be subject to a penalty. The penalty for drug coverage works a little bit differently than the penalty for Medicare Part B. Medicare Part B penalty was 10% of the monthly premium for every year you delayed enrollment based on that year's monthly premium. So if you waited 3 years, your penalty would be 30% of that year's premium. So you multiply the premium times 30%, whatever that came out to, would be tacked on top of the monthly premium for Part B every month forever. With Part D benefits, D for drug, it's 1% per month for every month you will without Part D coverage or other credible drug benefit. That 1% penalty also accumulates over time. So the longer you wait, the higher the penalty becomes. So if you wait a year, you're looking at 12%. If you wait 3 years, you're looking at 36%. That percentage is going to be multiplied by whatever the national average or benchmark premium is for Part D drug benefits across the board. For 2024, the national average benchmark premium that would be calculated on is $34.70 per month. So that's the national average premium for Part D plans nationwide. And again, anytime you incur a penalty, it's forever. So they tack that amount on top of your monthly premium every month forever and ever and ever. It never goes away. So the more you accumulate, the more you're going to spend over the rest of your lifetime. Unless you qualify for extra help or the financial assistance for Part D. It's called low-income subsidy, but most often referred to as extra help. And just like Medicare Part B, it is also subsidizing, meaning if you have a high income or a significant income, based on the most recent complete income tax filing that Social Security can access, you may have to pay a higher premium based solely on your income. Benchmarks are the same for Part B. So if you're an individual and your income in 2022, which is what they would look at first, is $103,000 annual income or more for a single person, you may have to pay a higher Part D premium. For a couple, it's 206, and so on and so forth, up to 500,000 for an individual or 750 for a couple. Obviously, because it's based on a much lower cost, the Part D premiums are much lower than the Part B premiums. The amount that you have to pay extra is going to be lower as well. So how does Part D benefits work? So the basic outline of any Part D benefit, whether it's a standalone Part D plan or part of your Advantage plan, says that there will be an initial deductible. What that means is, once you're enrolled in a Part D plan, that plan goes into effect. You go to the pharmacy to get a refill for the first time in January. If your plan has a deductible, you are going to have to pay full retail price for whatever medications you're refilling or picking up until you spend, in 2024, it was $545. Next year, it's going up to $590. Once you've met your deductible, and it doesn't matter whether or not you meet that with the price of one drug or if it takes several months over the cost of a handful of drugs. As soon as you spend out of your pocket in retail cost $545, you get into the next level of coverage, which is called the initial coverage zone. At that level of coverage, the next time you go to the pharmacy, you should pay a much lower cost in the form of a copay. That copay represents approximately 25% of the retail cost of that drug, and the plan pays the other 75%. However, most plans do better than that. For example, there are many plans that may have zero copay generics or $1 or $2 copay generics. So you're not going to pay 25%. You may pay much lower copay. But for calculation purposes, that is the most that they can charge you at the pharmacy after your deductible is 25%. That level of coverage ends when the total retail cost of your drugs has added up to $5,030 in this year. within this calendar year. At that point, you hit what they call the coverage gap, or what has been commonly known as the donut hole. When you get to the donut hole, you again are going to pay a maximum of 25% of retail. The difference between the initial coverage level, 25%, and the donut coverage level of 25% is in the initial coverage level, you could pay $0 or $1 or $2 generic copays. But once you hit that coverage gap or that donut hole, you will actually pay 25%. So you will actually have to pay that percentage. And they will continue to add up the cost of the drugs that you have purchased throughout the course of the year until your total drug costs equal $12,000 and change for the year. And this is retail costs. And then you hit what they call the catastrophic level of coverage, the highest level of cost coverage. Starting this year, if you hit that catastrophic level of coverage, your copays go to $0 for the rest of the year. Now, typically, I would say come January 1st, it starts all over. But there are some positive changes coming to Medicare drug benefits in the next year or two, and hopefully continuing moving forward. Effective this year, Medicare required that Part D plans provide $35 maximum copays for insulins. That doesn't mean every insulin out on the market is a max $35. What that means is Part D plans that agree to participate with this have a specific insulin that they will put at that $35 copay max. And if the plan that you are looking at includes that insulin, that's what you're going to pay. But that plan could also offer other insulins that don't have that max. Hopefully that will get better to where all insulins are required to max out at $35. They're still working on that. So if you have insulin and it's one of the expensive ones, definitely might want to look at a plan that has that $35 max copay. Also starting in this year was that $0 out-of-pocket copay if you hit catastrophic level of coverage. If you qualified for extra help starting this year, prior to 2024, there were different levels of extra help based on income and resources. So if you had a higher income, you may qualify for less assistance than if you had a lower income. You qualified for more assistance with your Part D coverage. Starting this year, everybody qualifies for full assistance, regardless of that income range. So if your income is anywhere under the max income and asset limit, you get 100% full assistance. Starting next year, Medicare drug plans will have a $2,000 max. The most you'll spend in that given year will be $2,000 out of pocket. There will be no more catastrophic. There'll be no more donut hole. Once you hit $2,000 out of your pocket, you go to $0 copay for the rest of the year. And Medicare has started negotiating with the drug manufacturers, finally, on the drug prices for some of the more expensive and more commonly prescribed drugs, such as Jardiance and what's that heart medication that everybody takes? There's like 10 of them that they're negotiating this year. The negotiated prices, the lower prices, won't go into effect until 2026. But they're starting the negotiation this year. Next year, they'll negotiate 10 more drugs. The year after that, they'll negotiate 15 more drugs, and so on and so forth. So that will continue to improve the cost of those high-cost brand name drugs. But again, negotiations going on this year. They'll be finalized next year. They'll actually go into effect in 2026. Yes, ma'am.
Is the glucose monitor considered as covered?
So the glucose monitor included as a Part D, as Part D benefits. Actually, no, it's not.
Because I wouldn't pay co-pays on it.
So glucose monitors and the test strips that you need to use to test your blood for the diabetes,
Yeah.
those fall under Medicare Part B as a durable medical supply. So even if you get the insulin through your Part D plan, If you get the monitor and the test strips through the pharmacy, they're going to bill Part B as in boy of Medicare for those supplies. And Medicare will typically pay 80% for the cost of those supplies. And you pay the other 20%, or you may have a Medigap that pay the other 20%. Or if you're an Advantage plan, you might just pay a copay. But yeah, that is billed under Part B as in boy, not D as in drug. Just the drugs, just drugs are covered under Part D. Yep. So what kind of drugs are required to be covered? Every Part D plan, whether it's a standalone plan or part of an Advantage plan, is required to cover at least 2 drugs in every class of medication. For example, if there are 20 different high blood pressure medications, each plan is required to only cover 2 out of those 20. What that means is each plan could cover a different 2 of those medications. So it is really, really important to make sure that whatever plan you enroll in covers your specific medications.
Does that change yearly?
That can change yearly. Drug plans are allowed to change the drugs that they cover every year, as well as the copays, the tier levels, all that kind of stuff. So things can change. So it is to your benefit, honestly, to take advantage of that annual open enrollment period to review what the options look like for next year and make sure you're getting the best deal year after year. And many people do change their Part D plan every year because the plans can change that much. Now, that's when it comes to standalone plans. They will change a lot more often. If your coverage is through an Advantage plan, those plans change less often. They stay a little more stable as far as the drug coverage formularies are concerned. Not necessarily the cost, but the formularies at least. So every plan must cover at least 2 in every class of medication. They can cover more than 2, but the minimum is 2. There are 6 classes of drugs that every plan must cover any drug available in those 6 classes. Those are going to be your antidepressants, antipsychotics, anticonvulsants, antiretrovirals, immunosuppressants, and the antineoplastics, which are cancer drugs. Any drug available in those 6 classes must be covered by any Part D plan. Also, Part D plans can only cover drugs that have been approved by the FDA for their intended medical use. I was really surprised at how many drugs predate the FDA. Very common, very low-cost drugs. They are out there, they predate the FDA and are not allowed to be covered under Part D because the FDA has yet to review and approve them officially. All plans must cover the drugs, including biologicals and insulins. They do need to cover the supplies for injecting insulin, not the monitor, not the test strips, but the syringes, the gauze, the alcohol swabs, those would be covered under Part D for insulin. And every plan must cover both brand name and generic drugs on their formulary. Things that are not covered under Medicare Part D. Anything that's considered over the counter doesn't require a prescription. Anything that was already covered under Medicare Part A or Part B. For example, if you have to go to your doctor's office to get an injection every month, that would be covered under Medicare Part D, or Part B as in boy, not D as in drug, because that's done in the doctor's office. Even if it requires a prescription, if it is a drug that's prescribed specifically to treat anorexia or for fertility purposes or for cosmetic purposes, they're not going to be covered by Part D. Even if it requires a prescription, if it's specifically for cough and cold symptoms, guaifenesin, i.e. Robitussin, is a perfect example, not covered by Part D. Most vitamin and mineral supplements are going to be considered over the counter. If it requires a prescription and it's being prescribed to treat a specific disease, it may be covered under Part D, but it has to be for a very specific reason. But as a general rule of thumb, vitamins and minerals would be treated as over the counter and not covered. So any questions from the Zoom audience? If you do have a question, you're welcome to unmute and ask your question, or you can type your question into the chat. Or any questions for my live audience here. All right, not hearing any, so we will move on. So basically, that's how Part D works in a nutshell. Again, that's how it works, whether you purchase a standalone separate Part D plan or it is part of an Advantage plan. Or same benefits work the exact same way. I did mention that there is financial assistance available for people who may have limited or lower income and resources, specifically for Part D benefits. That assistance is applied for directly from Social Security. You do the application through Social Security. Some people will automatically be enrolled in this extra help benefit assistance. For example, people who may be already on Medicaid, or for people who are on SSI, supplemental security income versus Social Security retirement income. People who have applied for and become eligible for Medicare savings programs once they're on Medicare. Those people will automatically get extra help on their prescription coverage. Everybody else has to apply.
Question from the chat.
Yes.
Are there cheaper plans like ones offered by Walmart?
So many pharmacies offer their own internal discount programs, which can have some lower costs for some prescriptions. Typically, the lower the cost of the prescription, mostly generics, the more you might save through a discount program. Those are not insurance plans or programs, they're discount programs, and they're usually internal with whatever pharmacy. I know King Soopers has one, Costco has them, I think Sam's has them maybe. And that's totally up to the pharmacy. And if you can get your drugs cheaper that way than through whatever Part D plan you enroll in, more power to you.
And it says, I understand Walmart Plan D could be cheaper than Medicare Plan D.
So Walmart does not have a Plan D. Walmart partners with Humana to offer, so Humana offers a Plan D, a Part D plan called Humana Walmart. So it's a partnership, but it's not a Walmart plan. What that means is if you get that Humana Walmart Part D plan, you may pay lower copays if you go to the Walmart pharmacy versus going to King Soopers pharmacy with that plan. Walgreens does the same thing. So there's a Walgreens, and I think it's an AARP Walgreens partnership. If you use Walgreens when you enroll in that plan, you're going to pay lower copays than if you went to King Soopers.
I'm a type 1 diabetes, so
Mhm.
I did my supply to my primary doctor in Denver, UC House.
Okay,
They have a medical supply, just like a small.
so they have their own internal pharmacy and whatnot.
Here, then from Walmart or Walgreens.
Okay.
And it comes down to price.
And honestly, it used to be where not even pharmacists could tell you if you could get it cheaper by paying cash versus paying your copay. That has changed. Pharmacies are not only allowed to tell you if you can get it cheaper other than through your drug coverage, but they can offer that to you. If you can find a cheaper price, again, more power to you. With the cost of drugs these days, if you have to juggle that around to get the best deal for whatever you need to take, you can do that, absolutely. Whatever you get that doesn't go through your Part D plan does not count towards those coverage levels either. So if you can get a brand name drug cheaper by ordering it from Canada, you can do that, but it's not going to be applied towards your drug coverage either, towards your out-of-pocket, and starting next year, that $2,000 cap. So if you would otherwise have made that cap in, say, 4 months on a Part D plan, but instead you were getting that $500 drug from Canada, it's going to take you longer to hit that $2,000 cap in the Part D coverage. So it's going to be longer before you hit those zero copays for the rest of the year, as an example. Does that make sense?
Do Part D plans play well with other programs? I mean, can there be a co-insurance instance where the Part D plan works with another co-insurance? I mean, the only time I've seen that is when somebody had Medicaid and it didn't play well with other insurance.
Okay, so the question is, does Part D coordinate with other insurances, basically, or other coverages? Once you're eligible and enrolled in Medicare, your drug coverage will be Medicare Part D, period. If you also have Medicaid, and there are drugs that Part D won't cover, but Medicaid does, Medicaid can pick that up. Is there a coordination where other coverage may pick up your copay under Part D? So that you get the drugs through your Part D, you pay your copay and then you can get reimbursed from some other type of coverage? Typically, no. You can't buy or have like a secondary insurance to Part D. Now, there are exceptions to the rule, of course. For example, if you are a federal retiree, would be one of the only examples I can really think of. If you're a federal retiree and you enroll in a Part D plan, the federal drug benefit that comes with the health benefits for those retirees could act as a secondary to Part D. But once you're enrolled in a Part D, that is your Medicare drug coverage. That is your drug coverage, period. And typically, you're not going to find something that helps cover that copay cost or that deductible cost.
From the chat, can I switch to Medicare Plan D at a later date without penalty?
If you are enrolled in other creditable coverage, meaning coverage that is as good as or better than what Part D offers until that moment. So if you're still working, your employer has health coverage that you are enrolled in, and it has drug coverage included that's better than Part D. When that coverage goes away, you can enroll them in a Part D without penalty. But if your coverage is not as good as, or you simply don't have coverage, and again, the easiest example is you don't take any prescriptions. I often get the question, why would I enroll in something that I have to pay for when I don't take any drugs? And the reason being is they want you to treat Medicare benefits like you treat any other health benefit you've ever had throughout your life. We don't enroll in health insurance or car insurance or home insurance because we are going to use it or we want to use it. We enroll in it just in case we need it. And they want you to look at Medicare benefits the same way. That's without regard. You're going to be able to and allowed to enroll in benefits if you wait, but you will have to pay more for
So
having waited.
clarification. I mean, from Humana Walmart 1 year, but next year switched to Plan D offered by Medicare Plan D.
Well, Humana Walmart is a Medicare Plan D. So there are, again, these are private companies that have been allowed to contract with Medicare to act as your benefit, your Part D drug benefit. So there are 20 different plans to choose from. Those plans are offered by, I want to say 8 companies maybe total. And there are several companies that offer more than one plan. So Humana's big, AARP's got several plans, Aetna, Clear Spring. There are a lot of plans out there. Humana Walmart is one of those plans. It is a Part D plan. And you can switch from one Part D plan to another Part D plan without restriction every year during open enrollment. That October 15th through December 7th enrollment period every year. That's the whole point of that enrollment period, is to allow you to look at what options are available the next year. Some plans may go away, new plans may be added. Some companies may add more plans. Some companies may take more plans away. So much can change from one year to the next based on whether or not that company is making money, I guess, and what they want to do in that market. So it is to your benefit, again, to take advantage of that annual enrollment period. Make sure you're getting the best deal from one year to the next. If you don't have to change plans because the plan you have next year is still going to be your best deal, great, but at least you'll know that for sure by taking advantage of looking at that information during open enrollment.
Another question from the chat. You didn't specifically mention if the same rules apply if you're covered under a spouse's private insurance as if you're covered under your own employer.
So private insurance versus employer insurance.
I think they want to know about spouse's insurance versus employer's
Okay.
insurance.
So if you or your spouse are covered under active employer coverage, whether you're the employee or your spouse is the employee, if you cover your spouse under that same coverage while you're actively working, yes, the same rules apply. You're allowed to delay without penalty enrollment into Medicare A, B, or D. Absolutely. So that's for the employee and their spouse. Any other questions?
Yeah, 20 different plans, is there a copy of that, or where can you find it?
So, and we'll talk about that. So give me just a minute. Let's get through the extra help and then we'll talk about that in detail. Any other questions before I finish up with the extra help? Okay. So again, to apply for financial assistance for Medicare Part D, that goes through Social Security. The application is actually short and sweet and painless. You can do it online at the Social Security website, ssa.gov. Takes less than 10 minutes. You don't have to provide any proof of anything. Basically, by doing that application, you're going to give Social Security permission to look at whatever electronic records they're able to access to verify income and assets. Less than 10 minutes, you get a decision within 3 weeks by doing it electronically. You can do it over the phone, you can do a paper application, but it takes much, much longer to get a response from Social Security, whether you're approved or not, by doing it those ways. We do help with those applications. We can do them over the phone with you. You get on the phone with me, I'm gonna go to ssa.gov. You don't have to log in or anything. It's an application you can just do and submit. And you get a confirmation page, and then you just wait for Social Security to respond to you to the application by mail. Income and asset limits for individuals and married couples for this year. Again, anybody who is under $1,903 for a single person or $2,575 for a married couple, pre-deduction dollars, gross income, will qualify for the full extra help benefit. Asset limits, 17,000 for an individual, 34,000 for a married couple. What they're going to look at are financial accounts, checking, savings, look at stocks, bonds, annuities, IRAs, those kinds of liquidatable assets. These are much higher limits than for the Medicare savings programs that help with the Part B premium. So hopefully more people will qualify for help with drug coverage than qualifies for help with Medicare Part B. Those numbers automatically include a $1,500 burial disregard for the assets. So those are the maximum amount of assets income you can have. Those numbers do increase every year based on the cost of living. And again, if anybody has any questions or wants to talk in more detail about any of these programs, you're welcome to give us a call. If for some reason your income and resources are going to be over those limits, but you may still take some really expensive medications, you're going to have a hard time paying those copays, you could potentially qualify for patient assistance through the drug manufacturers. Each company that manufactures prescription drugs does have their own internal assistance programs. Each company has different criteria for qualifying for their assistance programs. But if you can qualify, typically they will provide that expensive brand name drug for the rest of the year at no cost. Typically, patient assistance programs are going to be for the brand name drugs, the more expensive drugs. Very rarely are you going to find any assistance through the manufacturer on anything generic. And I've listed several websites that you can access to find more information about what drugs may offer patient assistance. Okay, so how do you find the best Part D plan for you? And this is a very, very individualized search, because you're going to need to consider the premiums for the plans, the copays, the deductibles, make sure all of your drugs are covered under any given plan. Ways you can do that? Well, you can get a list of all the plans and call each one and give them a list of your drugs, have them tell you what the copays are, the premiums, and just make your own little spreadsheet, I guess. Or you can call an agent or a broker and have them do that for you. Or you can go to the Medicare.gov website and do it yourself. You're always welcome to come to one of us and we'll walk you through that process as well. But honestly, the Medicare website is your best bet. It is going to be the most accurate, quickest, easiest way to find out what plan is going to be the most cost-effective benefit for you in any given year. Week 1, I did include in your handouts, this particular handout that walks you through creating a Medicare account, personalized Medicare account. Quick and easy, takes less than 10 minutes. It is secure, but you don't have to jump through the security hoops like you would creating a Social Security account. Quick and easy. Whether you create an account or not, you can still do this. What Medicare has done on their website is they basically created a search engine we call it the Plan Finder. And it allows you to put in all of your specific medications down to quantities, dosage. You can enter up to 5 pharmacy preferences, including mail order. It's going to take all of that information and compare it to the plan choices that are available based on your zip code. So it's going to do all the math for you. And the end result of that search is it's going to list the 20 plans in order of the plan that's most cost effective based on your specific drug needs at the top of the list to the plan that's least cost effective at the bottom of the list. So it's going to be in order of cost. To do that, you simply go to Medicare.gov. This is basically what the homepage looks like these days. And you're simply going to want to go to the tab that says Find Health and Drug Plans. Next page is going to either ask you to log in if you've created a personalized account, or you don't have to create an account. You can do a generic search based just on zip code. So if you do it based just on zip code, it's going to ask you some questions, what your zip code is, whether or not you're eligible for extra help, and whether or not you think you can make a plan change at that moment. Are you in an enrollment period, a special enrollment period? Are you just becoming eligible? Regardless of how you do it, you enter all of your specific medications. And when you're entering those medications, and I'd run you through a demo, but we don't have time. It autofills. So if you're having a hard time spelling them or pronouncing them, which is my problem usually, it autofills drugs. It gives you a list of any and all possible dosages and quantities. You can pick up to 5 pharmacies. Copays can vary pharmacy to pharmacy with each plan. So pharmacy choice is important. The more pharmacies you list, the better off you're going to be able to find the best coverage. And again, that end result is going to list those 20 plans in order of most cost effective to least cost effective. Again, we do help with that through the SHIP program. We can do it over the phone. We can, if you don't have a computer where we can walk through it with you in real time, we can mail you printouts. And then once you get that printout, we can go over it with you over the phone so you understand what you're looking at. But it is the most effective way to find the plan that's going to work best for each and every individual. Just because you're married does not mean you guys are going to get the same Part D plan. Most of the time, that's not to your advantage to go just the same plan, because everybody's needs are different. Every plan choice is going to be individual. One of the ways you can get a list of those plans, the Medicare and You Handbook, specific to Colorado. So that Medicare and You Handbook, I think I still have a couple on me. And it has to be specific to Colorado. The camera can see it, probably not. You can either get this paper publication, but it has to be specific to Colorado, so it lists the plans in Colorado. In the very back, it's going to list every Part D plan available in Colorado every year and every Advantage plan based on area. If you don't get the Colorado specific one, it's not going to have that information. You can go to the Medicare website by doing the plan finder. It's going to list every plan out there, but more specifically based on your needs. You can call 1-800-Medicare, again, 24 hours a day, 7 days a week, 365 days a year. They'll help you with that over the phone. Basically, what they're gonna do is go to the plan finder and you're gonna give them the information, they'll feed it into that system. Or, of course, you can always contact your local SHIP office. That's what we're here for. That's what we're here to help with.
Question from the chat.
Yes,
Question on no income and help on Medicare. If I retire and I have no monthly income, but I have IRA more than the threshold, is there any help of any nature to pay for Medicare premiums?
no. You have to be within both thresholds to qualify. Basically, if you're over the asset threshold, they're gonna expect you to spend those assets on those needs until those assets are spent down to qualify for help. That's basically how the government, as any government assistance is gonna work. Any other questions?
Well, it seems like the one we just discussed, the with the, for the prescriptions is one of the easiest ones to figure out which one to do.
That search engine makes all the difference.
So why can't we have that for the other?
So the search engine does give you the information for Advantage plans also. So you can toggle between standalone drug plans, the 20 standalone drug plans, or the 37 Advantage plans available in your area or your county. And it's going to show you both the drug costs in order of most cost effective to least cost effective, but it will also show you each Advantage plan's copays for medical expenses. So you can compare plans for Advantage plans and drug plans through that plan finder search engine. For Medigap coverage, there is actually also a search engine that we have access to as SHIP counselors specifically. It's basically the same kind of search engine that brokers and agents use. But we've been given special access to it. So we can do the same similar kind of search for Medigap as well for you. But we have to do it. That's not something you guys would be able to access.
So we can call and make an appointment. with you.
Absolutely.
And Medigap is the supplemental.
The supplement, yep, Medicare supplement. So there are ways finally, I mean, we've waited on access to a Medigap search engine for, I don't know, I've been doing this 24 years. I probably waited 20 years for access to something like that. We just got it a few years ago. The plan finder for drug coverage came out as soon as the benefit was created. The fact that the government put together a Part D benefit for Medicare and the search engine all within like less than a year, and it worked and worked well, was very, very impressive, quite frankly. I'm still impressed 20 years later. And it still works very well. And it is, I'd say 98% accurate, which is pretty good. So that's basically all I have for you, except a reminder that we also do fraud education and assistance and are always looking for volunteers. And there's our contact info. Any other last minute questions before I let you all go?
Question from the chat.
Yes,
Are the timeframe enrollment requirements the same for Part D as Part A and B with regard to turning age 65?
correct. Yes. So you get that same 7-month initial enrollment window surrounding your 65th birthday. Absolutely. Yes, sir.
Are you also going to cover the Medicaid or is that?
So next week, our fourth and final presentation will cover how Medicare coordinates with employer coverage, retiree coverage, TRICARE and VA, and Medicaid. Absolutely. And that's a really short and sweet presentation because it's usually mostly questions. But yeah, absolutely. We'll talk about all of that next week.
Everything's on Tuesday at 5 o'clock.
Yes, and I will be on time, I promise. I'll leave extra early. Yes, sir.
So if I create a Medicare account, is it going to throw me into anything I don't, know?
No, and you have to be enrolled in Medicare to create the account because you have to have a Medicare number. But you can enroll in stuff. You can enroll in a Part D or Advantage plan through the Medicare website. but you can do that regardless of having an account. The account is just for your convenience, and it is convenient. Once you have an account and you start putting your medications in, it saves that list of medications, so you don't have to input that in every year during open enrollment. It can, it has an electronic health records option that you can use if you're comfortable with your doctors accessing your electronically through something like that. There are lots of benefits to having these accounts, but they're not required. And you don't have to have them to do any of this. Again, you can go in there and just do a generic search based solely on zip code. And I go in there doing based just on zip code, all the time. I can just go in and do a search for one drug because someone had a question what the copays might be like when they turn 65 in 6 months. So you can't really screw anything up. You can't really accidentally enroll in anything. And I go in there and play around all the time. And I don't have a Medicare number, so yeah, it's actually very, very user friendly. Absolutely.
You can enroll in part A and B, say a month before you turn 65, and you still have 3 months after to select a part D.
So yes, so the initial enrollment period surrounding your eligibility by turning 65 is up to 3 months prior to that month of your 65th birthday, the month of, and up to 3 months after the month of your 65th birthday. As long as you enroll in what you need to enroll in, whether it's A and B or D or an Advantage plan, before that 7 months ends, you're not going to be penalized and you won't have to wait for anything.
Okay, thank you.
And whatever month you enroll in, except for the 3 months prior to your birthday, whatever month you enroll in, your coverage will start the first day of the next month.
And we can call and make an appointment with you to help us with finding the best one. What was it? A and B? Is that what you, no?
So I can't help you enroll in Medicare. You have to do that through
Yeah.
Social Security.
Put you with a supplement.
But I can sit down with you and go over the supplements in more detail, the Part D, the Advantage plans, whatever you need. Keeping in mind that we're not taking in-office appointments until Labor Day, after Labor Day. So we did just finally get confirmation that we should be able to move back into our office the day after Labor Day, so September 4th, I think that is.
So we can make it as soon as Labor Day's over, we can make an appointment.
Yes.
Okay. Good.
Or if you want to call and try and get an appointment scheduled for that week, you can. You're welcome to do that. Yeah, and just call our local number, and any of my other 4 counselors can also sit down with you and do that.
Thank you.
Because if you ask specifically for me, it might be a while before I get back to you. Just a heads up. Okay, any other questions? You guys ready for the pop quiz?
I have a question. It's not a part of you. Original Medicare cover for 80%, right?
So original Medicare Part B typically covers 80%, yep.
But if I have 20%, either I have a Medicare or private insurance is supplemented for 20%.
So Medigap is specifically going to pick up that 20% after Medicare pays their 80%.
Yeah.
Yeah.
These are Medicare plan, they have a out of pocket cost, let's just say.
So
$2,000 a year.
Advantage plans work differently because it's not a 80-20 split.
Right.
With Advantage plans, you just have a predetermined copay for each service. So you go into the doctor's office, you should know what your copay is going to be up front. You don't have to worry about what is Medicare going to pay 80% of, and then have to worry about the other 20%. It's just a predetermined upfront copay. Yeah. And that's supposed to be one of the advantages of the Advantage plans, is that you know what your costs are supposed to be upfront most of the time. Okay. Any other questions? All right. Again, next week, we're going to talk about how Medicare coordinates with everything else. Well, as much as everything else as we can cover. But thank you for joining us. Hopefully I'll see y'all next week.